Hi, Ryan Stileson here with Business Trends TV, and today I have Gloria Ospina with me. She is with Gables Perfect Smile, and as you know, on Business Trends TV, we evaluate and bring to you businesses that are setting trends in their respective industry. And again, I have Gloria Ospina with us today. She's gonna introduce herself. Gloria, how you doing?
Good to you.
Doing
Hello,
well.
my name is Gloria Ospina, and I am a general dentist. In my practice, we focus in cosmetics, implants, and laser dentistry. I have over 20 years experience, and I'm very passionate about laser technology. I have a wireless equipment, and I am really enjoying all the benefits that all my patients are getting from it.
Awesome, awesome. Well, Gloria, we've got some questions that are prepared. Actually, 7 questions that people are asking you continually in order to find out more from you. In order to, there's some FAQs that people ask you on a regular basis. So why don't we just go right into those? Obviously, you've got a very extensive practice down there in Miami, and you guys are kind of setting trends in your respective industry. So what is the most important aspect that you evaluate when you're studying a patient's smile? Can you kind of give us an idea of that?
Yes, when I see my patient for the first time, I just need to understand where they're coming from. I just need to understand what they don't like about their smiles, what all the insecurities, what is how they're refraining from smiling, so I can understand, and then I can explain things for better or solutions for their smile.
Okay. So what I'm hearing is that you really try to get to know the patient first. You want to get to know the patient first in order to get a better understanding of what their expectations are and what they're looking to do before you get started. Is that kind of what you're saying?
Yes, that's what I mean with patients these patients that are in my website. They came from different consultations, so I see this patient is showing too much gum, and this is how I left the girl. This also missing a tooth and replacing the tooth and lowering the lip, like the lip repositioning.
Nice.
This girl that I did a smile makeover, and she didn't like to smile because she found her smile very uneven, and like her face just
Wow.
form. And this girl that had an accident, and the dentist had to put a wire in her teeth, so she can hold the teeth from moving, and I created
Wow.
this so I can evaluate under different situations on my patients, so I can address the best solution for each one.
Those are amazing differences. I like how you have all those right on your iPad. Obviously you guys have a lot of technology there behind you. It looks like you really do leverage technology in order to get the best results that you can get for your patients. It sounds like you guys really have a lot of different strategies that you can use in order to get the best smile results. Those are some dramatic results. Getting rid of the gummy type smile, and then obviously that one girl had the chipped tooth. You fixed that. That's amazing. So I really like the results that I'm able to see there. So let's go on to the question number 2. You mentioned the lips and gums, the soft tissue. Why did you mention this before the other aspects such as size and position and color of teeth? So can you kind of give me a little bit of insight on that?
Yes, I mentioned this because it's not only teeth. When I'm looking at patient's smile, it's just everything is surrounding the teeth. For instance, this patient has this smile, and she just she shows too much smile, but when I do the examination, I found out that she's got these bone bumps underneath her lips, and just removing that bump, I just created a transformation of the gummy smile.
Gotcha.
So that is creating like the proportion, harmony, and symmetry of the face. So from this, just removing the bumps underneath the lips, just I was able just to transform the smile.
So it's
every patient is different.
okay. So what you're saying is you treat every patient as an individual, and it's not just about the size, position, and color of the teeth. It's you got to look beyond that and really determine and look at maybe other aspects or physiology that might be going on in the patient's underlying, bone structure in order to find out the best solution. Is that kind of what you're saying?
Yes. This is like when patients smiling, they have a misconception. I'm going to just make my teeth pretty. But when I look at the patients, I just realize it could be just the gums they're showing too much, or it could be like the teeth are just needed to be aligned and recontouring, or the patient just think it's just the whining. So I just need to educate my patient.
Gotcha. So you want to educate your patient on what the best you want to educate the patient on what the best procedure is for them, because not every patient's the same. I mean, obviously, they might have a gummy smile and they might just think that they're going to come in and get their teeth whitened and get them adjusted or repositioned. But there's other things that you can do, obviously, in order to make each individual patient smile the best, I think is what you're saying. So I think that's awesome. So let's go to question number 3. Is you mentioned the gummy smile. How do you correct gummy smile in your patients?
Well, I correct gummy smile by evaluating the gums first and making sure that there's no bumps underneath the lips and diagnosing it properly. So, for instance, this patient, he's got this lip that goes really high, and the solution for this patient was just not only to raise the gum line,
Yep.
but it's just to lower the lip.
Gotcha.
So when I did the surgery with the laser, I obtained this result.
Wow.
So
wow. That's an amazing difference. I mean, you go from he has a lot more gum there, so you actually altered something in the lip as opposed to with the teeth.
I did both. That's why the diagnosis is so important. So I raise the gum line, and also I have a technique where I lower the lip. I do a technique with the water lace, and I remove some tissue underneath the lip, and I move down with
Yeah. So do you need any special training in order to do that? Because it's almost like reconstructive surgery. You're almost like a plastic surgeon, if you will.
Well, it's been 10 years since I've been doing laser, playing with my water lace, and like I said, I became really passionate. So I created some of my own techniques to do this.
Okay. Wow, that's impressive. So you've got some strategies and techniques that you have developed over the past 10 years from from experience in dealing with this particular type of case. It sounds like. Is that what you're saying?
Yes.
Okay. Awesome. I'm glad. So let's go to number 4. Is the size of someone's teeth important? The length and the width, for example. What do you have to say about that?
Yes, the size and the length is important because when the proportion of the face is telling me if the patient needs to have like a crown lengthening to show more teeth and less gum, or to increase the length with resin or porcelain. So the shape of this face, for instance.
Yeah, lift it up a little bit, a little higher. There you go.
Yeah, and look at her teeth. So when I did the work, just make the face more like in harmony, more in good proportion,
So you actually altered some things on her face, is what you're saying.
Exactly.
How did you do that?
Just with porcelain veneers in this case, I did. I did in, and some gum reconstruction.
So you did some gum reconstruction, and you also did some porcelain veneers on the teeth.
Exactly.
I got you. Okay, so the length and width of somebody's teeth is important, and so that's what actually added to her smile. Is that you actually did you lengthen the teeth on her, or what did you do exactly?
Okay, on her, she had an accident, and there's a lot of things with her. I could have placed an implant. I worked with her gums. I work in the position of her teeth, and I work in the color of her teeth.
Okay.
So I changed the entire smile.
Okay. Awesome. Well, that's really great. I mean, so you changed your entire smile by, again, giving a specific diagnosis to a specific patient, and really, identifying what her specific needs were, and that's awesome. I think that you did a great job there. So let's go on to another question here. We've got number 5. Can you change the face of the person just by changing the position and shape of the teeth? Is there a way to, to change the face of the person by altering the teeth? Is that what? Can you do that?
I have to interrupt.
Okay. So do you have an example?
Can we interrupt it? Can we pause?
No, we got. So keep go ahead. Go ahead. Okay, we can go on to. Yeah. So you got. Do you have a?
That's what he's talking about. The size of the teeth. No, Ryan. I have everything prepared, and it's not going smooth. So she's giving me one thing, and she's giving me other thing from other questions. So when you get the question, I already took that. So I'm sorry. I think we just need to start all over again.
No. We're not going to start over. We can start with number 5. So what? So number 5. Can you change the question I have is, can you change the face of the person just by changing the position and shape of the teeth?
You see the last photo. No. The one that I just explained, that's the answer of that question. So when you're asking me, that's the photo that I needed to
okay. Okay. So what about? So let's go on to question number 6. Okay.
No.
Okay. Question number 6. Ready? We're gonna edit this out. Let's go to question number 6. Can you change the face of the person? So one of the question number 6 is, can you change the face of the person by changing the shape, size, and bite on somebody?
Yes. Changing the bite of a person and the shape. For instance, this patient came to me because he didn't like the smile.
Okay.
And I just building up the smile, the bite, I was able to create a new smile. So what happened is like he wasn't showing the upper teeth. He was just showing the lower teeth. So I had to reconstruct the whole bite and be able to do some crowns and get the size of his teeth bigger and do the whole teeth, the whole smile, and getting a totally different person.
Okay, so the left one, the before, it obviously looks a lot different than the right. It looks much better after, and what you're saying is that you've actually adjusted the bite, and that's what made his teeth actually look better, his face. And what you did is you changed the shape, size, and bite on somebody, and that really altered the look, the overall look of his teeth and his face, actually, correct?
Yeah, that's correct. That's correct. This patient didn't understand at the beginning, but with examples and photos, and we actually did like a design or a mock-up of his teeth on a model and created something in his mouth for him to understand, and we put it in his mouth, and he was able to really see how he was going to look like, and he understood, and he said, I want to start immediately. So he was very, very happy.
Awesome. That is awesome. Well, we got one more question for you, Dr. Gloria. You've answered a lot of questions. I'm sure there's a lot of people that maybe have a situation like you've talked about, maybe either a gummy smile or an off bite, or there's maybe just people want to change the look of their face, and you're saying obviously you can do that by simply just adjusting certain things or certain aspects of the bite or of maybe the lip structure, things like that. And there's so many things that you can do in order to help somebody really achieve the look that they want with their smile and with their face appearance. So I think it's really amazing what you're able to do. And I think that there's probably a lot of people that are learning a lot today. So thanks a lot. And let me just go on to number 7. Almost everyone wants white teeth. What would be the determining factor to see if a patient is a candidate for teeth whitening? What do you think is the determining factor on that?
Okay, for whitening, the best way for patients is just to come for a consultation, so I can look at the quality of the enamel, so I can look at the color of the teeth, if the habits or the things, the health, and then I can determine like what type of whitening. There's some patients that the chemical over the teeth are not enough for them, so I have to give them other options, because the chemicals, they might not be getting the results what they want. For instance, this patient came to me on
okay, just hold that up higher. There you go.
She came with several issues. She wanted to get teeth straight, white. She was showing too much gum. So I was able to correct everything with just the chemicals, like the Zoom whitening, and the 1 hour treatment in the office. So after the Invisalign treatment and the gummy smile treatment, I was able to give her white teeth, and the smile came out just beautiful.
Wow. So you did 2 things for her. You did the gummy smile treatment, you did the teeth whitening, and then what else did you do? Invisalign. So you straightened her teeth, you whitened them, and you did the gummy treatment.
Exactly.
And specifically, what is the gummy treatment? Does that lower the lip, or what exactly?
In her case, I did gum recontouring. I raised the gum line so the teeth would be longer.
How do you do that? What is involved in that?
With the laser technology, I do it in one visit, and there's no bleeding, no bleeding, and no pain.
So it's a painless, non-invasive, very easy treatment. Is that the actual machine behind you there?
Yes.
Do you want to really quickly just kind of show us what that machine is? Yeah, is that it?
This is it.
Okay. So that's the actual machine that somebody would use. Okay. Great.
Yeah.
So it's basically just a real easy treatment that somebody could just come in for what, an hour a treatment? Is it how many treatments do they need?
In just one visit.
One visit?
One visit, about an hour. Sometimes I do it with no anesthesia, and it just no bleeding when there's very little, for comfort of the patient, and they're usually a little apprehensive. I try to get them numb, but sometimes I can do that with no anesthesia. And also with teeth whitening, before we finish about teeth whitening, there's some patients that they have these tetracycline stains that no matter how much chemical we put in the mouth, we're not going to get results. So I'm going to show this case here.
Okay.
This is a patient with tetracycline stains, and I was able to give her the color that she wanted, even though she didn't finish her treatment at this moment. But I was able to give her the beautiful smile without the chemical Zoom whining, just doing just porcelain restoration.
Oh, so you did porcelains on her in order to give. So you actually put an enamel on the outside in order to give her the white teeth.
Exactly.
Got you.
Exactly.
Okay.
Yes. And I use my water lace in this type of restorations to just clean the gum line and obtain a better copy of the digital impression machine, the Aitero, so I can provide the best information to the lab, so the lab gives me nice margins, nice finishing, and the results are amazing.
Awesome, awesome. They look amazing. I mean, I'm impressed. So maybe when we come back next time, would you be open to showing us how that laser works, so that people that have a gummy smile, we can just focus on that, and maybe we can just show an example of how that machine works?
Yeah, sure. I'd love to.
Okay. Yeah, I mean, I think it'd be great to actually see, because I think some people might be apprehensive about a treatment like that, but if they see somebody actually doing it, they see them going through the treatment, we could do a live Google Hangout showing that whole treatment, and then,
Sure.
People could actually see how it's done, and I think you could ease a lot of people's fears by actually showing how easy, how non-invasive it is, and how painless it is.
Yes. If patients wants to understand better, they can just go to my website, and I have videos and I have a lot of information so they can learn. So that's gonna be very good before they come and see me.
Yeah, I think it is great. Let me, one of the things that we can do is, obviously in these Hangouts, is I can show my screen. So anyway, next time we'll show that, and maybe we can even, watch some videos together or show some examples of some treatments that you're doing. But I think we had a great meeting today. I think we really got a lot accomplished, and I'm really excited that you were able to give us this information. And now what we're going to do is we're just going to we're going to get this information out there and post it online. You've got, one thing I did notice, Dr. Gloria, is that you've got a great reputation online. You've got a lot of great reviews. I definitely recommend anybody that is looking for a great dentist, type in dentist Miami. I think Dentist Miami will pull you up, and you're right there on the maps result, and you can see that, Dentist Coral Gables, or even Cosmetic Dentist Coral Gables, and you'll see that she's got her reviews right there. She's got a Zagat score of almost a perfect Zagat score, so she's got a lot of great reviews from her past customers. And I guess, is there any other parting words that you want to add?
No, it was very nice talking to you, and I hope I can see everybody who's interested in this technology so I can meet them.
Yes, absolutely. And how would somebody get a hold of you? I mean, we've got this number here, so I guess the best way to get a hold of you is for them to call this.
786-382-0007.
Okay, so yeah, if anybody wants to get a hold of Dr. Gloria and her staff, just call the number on the screen there at 786-382-0007. And thanks for joining us today, Dr. Gloria. And we'll do this again, maybe in another month or two, and maybe do one of these live examples of a patient getting a treatment. I mean, how fun would that be? That'd be pretty neat, I think, wouldn't it?
Yes.
All right. Awesome, ladies. Thank you for everything, and we'll talk again soon.